Yes, you want to start?
I didn't.
Your city. You always get to start in your city.
Daydreaming, I'm sorry. So, thank you, Senator Shaheen, for coming to Nashua City Hall again to help inform us regarding what we hope is a coordinated national response to the coronavirus epidemic, pandemic. We have, in Nashua, taken a lot of steps to prepare for events that might occur, and the Senator Shaheen's effort to make sure that we're all working together and that we can coordinate with the national response, we really appreciate. So thank you for coming, and we really appreciate your help.
Well, thank you very much. I'm really here both to talk about what I'm trying to do as a senator representing New Hampshire at the federal level, but also to hear from Nashua what you all need here, what concerns you have, so that I can take those back. And I noticed that there was a great, there are a number of Nashua officials here today, and I thought maybe we should start by introducing all of those folks so that everybody could understand. I think one of the things that I think is very important is for people to understand that this is a real cooperative effort between, at all levels of government, on both sides of the aisle in terms of the politics, and so I think it would be helpful for people to hear who else is here who can weigh in and be part of this conversation. So I don't know where you want to start, Mayor, maybe.
We have, of course, Senator Cindy Rosenwald.
Yes.
Maybe everybody else.
Good morning. Bobby Bagley, Director for the Division of Public Health and Community Services.
Good morning. My name is Melanie LeVake. I'm the Senator for District 12, which consists of 3 wards in Nashua and also the towns to the west.
Good morning, Brian Rhodes, excuse me, Fire Chief, City of Nashua.
Good morning, Michael Carrigan, Nashua Police Department, Chief of Police.
Good morning, Elise Butterworth, Emergency Management Coordinator, City of Nashua.
And we have Rick Dowd from the Board of Aldermen.
Are others?
Chris Daywaz is from AMR.
Yes.
He responds to all the medical calls, and many other people.
Do you want to just introduce yourselves in the audience if you work for the City of Nashua? So I have a better sense of who you all are.
Jen?
Yeah.
Mark Monroe, the Public Health Emergency Preparedness Coordinator for the City of Region.
Kim Bernard, our Mission Public Health Officer. Lottie Martin, Public Health Nurse, Community Disease Investigator.
William McKinney, Building Official and Manager of the Department of Building Safety, City of Nashua.
Sarah Marchand, Community Development Director. Kim Clark, Director of Administrative Services.
Barry Budrow, Human Resources Director.
Dorothy Clark, Deputy Corporation Counsel.
Can I get you all to stand up in the back so when you introduce yourselves?
Hi, Stacey Hines, Director of Communications for the National School District.
Ah, great.
Bruce Gardner, IT Director. John Griffin, CFO of the city.
Tim Cummings, Director of Economic Development.
Laura Byers, Appropriation Department of Public Works. Andy Patricia, Assistant Director of Public Works.
Megan Karen, Director of the Arlington Street Community Center. I am Gloria Brown, Energy Manager for the City of Nashua.
Larry Goodyear, CEO of Penachuk Corporation.
Oh, yes, of course. All right, thank you. Anyone else? And
Angela Constantino, Epidemiologist, City of Nashua.
Cecilia Ulibarri, Constituent Services, National Mayor's Office.
Allison Lee, Mayor's Office. Cheryl Lynn, Mayor's Chief of Staff.
You got Kate from the Chamber of Commerce.
Kate Lesko.
oh, yes, nice to see you. Also, I want my staff, if they would introduce themselves too.
Peter Clark, I do healthcare in the New Hampshire Office of Senator Shaheen.
I think it's really helpful both so that anybody watching knows the extent of the people who are available to help work on this issue, but also so that we all better know who each other is, so that, because when we've got relationships, I think it's always easier to get things done. So it's really helpful for me to have a better sense of who all of you are here in the audience. And I know we have some reporters here. Can I ask you all to introduce yourselves? Hi, Andy. Anyone else?
Greg Andrick.
From the State House.
Great.
Greg Andrick, Ward 7 state rep, but there are
Oh,
other reporters
nice.
back here.
Not reported, Dr. Julie from Southern International.
Oh, thank you for being here.
Michael?
Michael Ryan with the National Superintendent's Office.
And Letizia?
Leticia Ortiz with Senator James Jenkins' office, I do case work.
And Letizia is often in our Nashua office, so you may have run into her there. Well, did I miss anybody?
I'm Greg White with Lamprey Healthcare.
Oh, great. Thank you for being here.
And,
Well-
I'm sorry, Senator, we also have representatives from our homes together.
That's great. Thank you.
Mike Appleberg with the United Way.
Well, again, thank you all very much. As we know, we are facing a medical emergency that the World Health Organization has called a pandemic. Fortunately, we only to date have 6 cases identified in New Hampshire, but one of the things we have been told by the Centers for Disease Control is that as testing becomes more widely available, we will have more tests, and this will be a challenge for our healthcare system, both for our public healthcare system and for our private healthcare system. And what we're trying to do in Washington is respond to the resources that folks need at the state and local level, because you all are on the front lines of dealing with this medical challenge. And so, as I said, what I'm hoping to do here today is to tell you a little bit about what we've done to date in terms of providing resources in Washington, what's in the funding bill that was passed last week, and what we're working on to try and get into a bill that we hope to pass sometime next week if we can get some agreement on it, and also to hear what your concerns are and what your needs are. So in Congress last week, we came together on a bipartisan bill that provides $8.3 billion in federal support for a coronavirus response to address the disease of COVID-19. I think there's some confusion among the public about what the difference is between the coronavirus and COVID-19, but we're really talking about the virus that causes the disease. The bill that we passed included $4.9 million for New Hampshire's response. That money has already come out to the state. I think you're accepting it today at the Fiscal Committee, right, in Concord. And it goes directly to the Department of Health and Human Services, and they will decide how it gets distributed in New Hampshire. The reason the state got that $4.9 million is because that is 90% of what the state of New Hampshire normally gets in a year to address these kinds of medical issues. The bill also includes provisions that we and a number of other members of Congress fought for to try and make sure that there are reimbursements for costs that the state has already incurred to deal with the coronavirus. And so there will be additional funding to deal with that reimbursement, and it will be for any costs that were incurred between January 20th and March 6th. What I don't know is how that will be passed down to the municipal level, so we need to get an answer on that. I need to get an answer for you all on that. The bill also provides over $3 billion in funding for research to support a vaccine and treatment, as well as $500 million to acquire more personal protective equipment. All of the emergency and emergency personnel who are here know that that's one of the big challenges that we've got right now, is that we have an expected shortage of personal protective equipment such as masks, respirators, and gowns. So the hope is to, with those resources, to encourage more production of that personal protective equipment. This week, the delegation, well, Senator Hassan and I also called on the President to declare a national emergency under the Stafford Act, because that would allow for things like physicians at Dartmouth-Hitchcock who are licensed in New Hampshire to be able to do work in Vermont and vice versa, so that physicians could cross and medical personnel could cross state lines to treat in an emergency. That's also important as we think about some of the challenges that our medical personnel will face, because that will allow us to do telehealth. So Dartmouth-Hitchcock, for example, could do telehealth conferencing across into Vermont. Massachusetts could do it in New Hampshire. We could cross those state borders and not have to worry about having the physician be licensed in that particular state to do that telehealth conferencing. Now, obviously, we need to do more than that at the federal level, and we will be continuing to push on the administration on testing and on trying to ensure that those private lab companies that are now involved with the testing, Quest and LabCorp, are ramping up as quickly as they can, and working to address some of the other needs that we're beginning to understand as we think about people who may have to leave work, and whether they, because they don't have sick leave, how they will continue to support their families. So there's a package of economic assistance that's being negotiated right now. I don't know exactly how that will come out, but I can tell you there are a number of provisions that are being discussed that have to do with ensuring that anybody who needs a test can get that test without having any co-pays or any payments, whether you have health insurance or not. Right now, all of the major health insurance companies have said that they will pay for the testing for the coronavirus, but if you don't have health insurance, that's a challenge. So this bill would pay for all of those tests for anyone who needs it. It would also include sick leave for people who had to take time off to address their illness. It would include an increase in funding for Medicaid, so that states like New Hampshire that have both that have expanded Medicaid and that just have traditional Medicaid programs will have the funding that they need. And it includes an expansion of food stamp and other food programs, so that people who may have challenges because they're out of work for a period of time and need to continue to eat, obviously, that there will be some help for folks on that score as well. So all of that is being negotiated. I'm hopeful that we're going to have a package that's going to really help to address some of the economics of any widespread outbreak that we might see here in New Hampshire. And we also are talking about help for small businesses that might be negatively impacted. So that's what I know at this point, and what I'm really hoping to hear is what you all are doing here in Nashua to address it, and any questions that healthcare folks have or any concerns that we can pass along and try and support as I go back to Washington. So again, Mayor Donches, thank you very much for convening the group and for giving me this opportunity to hear from people what you need.
Well, we are, of course, taking measures right here. The Board of Aldermen recently appropriated some money to help fund the city's response. That includes things as simple as increasing cleaning and cleaning supplies to the extent we can get those. But also there are a number of things that need to be done to prepare for people who might have to work remotely, because that is not a typical event for the city on a widespread basis. So we need technology improvements. We need more Citrix licenses. We need an upgrade in various servers and things like that to make widespread telecommuting, teleworking possible if that becomes necessary. We are trying to inform the community about the ways to protect themselves. And it remains to be seen what's going to happen with the schools. I know the school board is having a meeting today at noon, presumably to talk about what's going to be done with the schools. My understanding is that there was a meeting of school superintendents today where this was, I think, the subject. But one concern, of course, that we always have is that although money is going to the state of New Hampshire, probably there are many municipal and school costs which will not be covered. It's just very difficult to get the state to pass that on to the municipalities. In the cities, we always like a direct relationship with the federal government, like community development block grants, so that.
Yes, which is why I'm here.
So that we know we're getting, so that you pass the bill and we actually get the money.
Yeah.
The ability to directly apply or to seek aid or however it's set up would be very much appreciated, I'm sure, in Nashua, Manchester, and all of the municipalities in New Hampshire.
And so, from your perspective, is the best way to do that through the C2BG program?
No, that's just an example. I mean, I don't know how you'd set it up,
Okay.
but that's just an example of
Okay.
of where this,
So you're
over
not-
the years, all this direct
Yeah.
city aid, urban aid has kind of gone away. CBDG is one of the
Few remaining.
Right, and it's just an example of that still exists, and that's a very good program for all cities.
Good.
But I think other people may have thoughts. I did want to recognize two people who we did not get to introduce at the beginning. Brandon Williams, could he please stand up? He is he's on the front lines too. He's the director of the Association of Private Nursing Homes.
Yes. I know Brandon well.
We have Pam Walsh. Where's Pam?
Hiding.
From Senator Hassan's office. She couldn't.
Yes.
She couldn't
Yeah,
get
Senator
here.
Hassan was going to be here, and she got delayed in Washington, so she's not able to be here. So Pam, I'm glad you were able to get here. And I thought there was going to be somebody from Congresswoman Custer's office, too.
Nick Brown.
Oh, hey, Nick. Nice to have you here as well. Let me ask the emergency responders, and Bobby, if either of you want to talk about some of what you're seeing and the challenges that you're experiencing.
Yes, Senator, we have put together a presentation that we would like to share with you
That would be great.
on our response here from the emergency operations standpoint and then also from public health.
That'd be great.
Okay, Elise?
So while public health is taking the lead on emergency response to the incident, our Office of Emergency Management is focusing on assisting the divisions in reviewing essential community functions and assessing the strategies best suited to combat the challenges posed by COVID-19. So all city functions are important, but not all are essential. So we have a basic set of questions that kind of help drive determining what is essential. Does the function need to be performed during a disruption to normal operations? Does the function need to be continued during emergencies? Is the function important? Is the function urgent? And are you required to perform that function due to law or regulation? So the two pictures obviously show a dog park, which, although that is important and everybody loves taking walks and trails, it is not essential compared to water, power, all those other functions. It generally comes down to, can the function be deferred during an emergency? If it can, it is non-essential. Our primary concerns to maintain services, as we've already discussed, are absenteeism due to illness or quarantine of employees, cascading impacts from outside vendors, and personal protective equipment such as the N95 masks we've discussed, and cleaning supplies shortages, especially for critical employees such as fire, police, public health, all of those functions that will continue operation and cannot work from home. COVID-19 concerns.
Can I ask you, when you say cascading impact from vendors, can you give us an example of what you're talking about?
Businesses, kind of supplies coming in, travel, cascading impacts from outside forces that aren't in our control.
Oh, okay.
Just,
And are you seeing any of those yet?
I don't think we have seen a enormous impact, but that's kind of why we're preparing, because it's now that we should start, not once we've seen
Absolutely.
those.
But one thing we're talking about, for example, is the economic effect that actions by the city could have. For example, community development has to permit, and building, and zoning, and the various departments in community development have to permit development. So the construction industry is very reliant on that.
Mm-hmm.
So if we shut down and you could not go there, people come here to do, to get a permit
Right.
on the day that they want to do the work. So were the city to shut down in that respect, much of the local
Right.
renovation, construction industry would just come to a halt.
Yeah.
As one, and we could probably come up with many, with other
Mhm.
examples, but that shows how this could cascade throughout the economy.
Now, if you were playing out that scenario, I assume that would only happen if for some reason you had to shut down City Hall.
Correct.
Because otherwise you will have people who could come in and
Right.
fill that function.
We thought of ways to possibly reduce the presence, but if we were to get cases within the city workforce, we'd need to consider protecting people by quarantining everybody. Attorney Jetty from the Board of Aldermen.
Hi, Ernie. We introduced most of the audience before you got here, so that's why we're calling you out.
So then
Gloria Timmons from the school board. Now, I think there's going to be a meeting at noon, right, to talk about the schools?
So then we established some mitigation strategies, because that's what everybody's looking for. So enhanced cleaning and facilities, education to employees on social distancing, revisions in sick leave policies, promotion of direct deposit, acquisition of additional remote networking hardware and licenses, as the mayor had discussed, and staffing contingency planning.
So can I ask, I know that there were 2 events that I was supposed to attend in Nashua today that got canceled because of the social distancing. I think a lot of people aren't quite sure what we mean by social distancing. One of those was the Wild Irish Breakfast, because it was a crowd event.
And I had some good jokes for you, too.
I'm sorry, I had terrible jokes. So I have to be honest, I was not sorry. I don't have to use my jokes.
Mine were written by someone else. So.
Okay. Yeah, mine were too. And the other was an event with teachers. So both of those got canceled because of crowd events. So when you say to employees about social distancing, how do you define that for people?
Defining that for people would be the essential functions. I mean, the police officers, the firefighters, they have to have the contact if it comes down to it. So determining when they don't need to, specifically for them, versus you need to, and
So
the
that's sort of an
precautions.
essential, non-essential
Yes.
function again.
Kind of determining for each department what social contact is essential, and maintaining that as hygienically as possible, versus can we do it via web, via internet, teleconference, maintaining your social interaction, but not contact. And that's the difference for us.
Thank you. I will tell you, I asked Anthony Fauci, who's the person who's been on television a lot talking about his role as the head of infectious diseases at the National Institutes of Health, how he defined social distancing yesterday at a briefing that we had. And he said pretty much the same thing that you did, except that I tried to push him on, so what size of groups are you talking about when you say we should cancel large gatherings? And of course, we've seen a number of those canceled, not only in New Hampshire, but nationally. And he said it really depends on the circumstances, on the community, on what's happening in that area. If you have an outbreak, as they had in Washington State, he said in Seattle, what they determined was groups of 250 or more should be canceled. I mean, that's a pretty big group for the state of New Hampshire. But I think what you're thinking about is a really good guidance to give people.
One more introduction. We did introduce everybody. Heather Raymond from she's the chair of the school board.
Ah, great, thank you.
President of the
for
school
being here.
board.
Apologize for my tardiness.
No, we're glad you got here.
So next we have public expectations, which is what we're addressing with residents as well as businesses. So we ask residents and businesses to be patient with us as we work through this incident. It is new to everybody, so patience is appreciated. Residents and businesses should expect disruptions as we work to be a part of the solution and to slow the spread of the virus. So the disruptions, as much as they're an annoyance, they are necessary. So just expecting that as well.
And I think it's really helpful to give as much information as possible to public. So I appreciated, Mayor, your decision to open this briefing to members of the press. I think it's important for people to have as much information and to know where to go to get more if they need it. That's really important. So thank you for that.
So finally, needed support or our request for assistance. Much you have already addressed, just going over unified messaging across all levels of government. This will be essential to prevent confusion and to maintain trust with the public. Municipalities will have challenges making critical decisions about the continuation of services if the federal and state guidance are not aligned. So that's something that we've been trying to push, is unified as in our level as well as state and federal. Assistance in wrapping up availability of critical personnel, PPE or protective equipment, and cleaning supplies, especially for the critical functions that we mentioned earlier. And preparing for the possibility of the Stafford Act, which you've already mentioned, so we're all thinking alike, which is nice. Because the funding, we are getting mass amounts at the state level, but our municipalities will most likely be taxed in a way that we haven't before. So addressing that would be ideal. Thank you.
Another introduction, Shoshana Kelly from the Board of Aldermen.
Bobby, did you want to weigh in on what you all are doing through public health here in the city?
Yes, Senator, thank you. And I believe we have some slides up that we'd like to go through as well to show what the public health response is and how we're all working collaboratively with our partners at the state level, the local level, with our city officials, and our community stakeholders as well. So I do believe, Cheryl, do we have that up there?
The
So
joys
while
of
they're
technology.
so while they're getting that prepared, we do have and understand the importance of what's happening around COVID-19. It's an evolving situation, Information is coming out on a daily basis at the national level, at the state level, and we want to make sure that we maintain ongoing communication at the local level here as well. I have Angela Constantino, who is our epidemiologist, who will go through some of the background on COVID-19, again, for that consistency in messaging. There's been a lot that's been put out in the news, and we want to make sure that everyone is on the same page with their understanding and understanding the importance of why we're responding the way that we are currently in New Hampshire and even here in Nashua and the greater Nashua area. Angela?
Yeah, sure. So this presentation is a presentation that we're giving to community members, that we're giving to city employees, that we've given a couple times now so that we can all be on the same page when it comes to this virus. And just to reiterate what Bobby said, this is a rapidly evolving situation. The guidelines from the CDC and the state are changing every day, and we have to keep up with that. So if we say something last week, it's going to be different a week from now. So just keep that in mind. So COVID-19 is a novel coronavirus. So as you know, like SARS and MERS, it is a coronavirus that jumped the animal-human species barrier. And this occurred in 2019 in December in China, Wuhan. January 20th was the first case in the United States, and March 2nd was the first case in New Hampshire. So I'm just going to give you a case update. So as of right now, there are 127,000 plus cases worldwide. And as of last week, we started to see the dip in cases inside of China and started to see an increase in cases outside of China. And so let's move forward. So for the United States, we have about 1,200 cases right now, 36 deaths, and about 43 states and districts reporting those cases. And of those, 125 are travel-related, and 102 are close contact related, and we have, I think, about 900 people under investigation right now. To move more locally, in New Hampshire, right now we have 6 cases. 3 of those are travel-related, and 3 of those are direct contacts to a case. And of those, 2 have been confirmed by the CDC, and 4 are considered presumptive positives, which means they have not been confirmed yet by the CDC. 3 of them are in Grafton County, and 3 of them are in Rockingham County. And currently, there are 21 tests pending at the state lab, and there are 273 people under investigation, or people being monitored. So just to review the epi background, so the case fatality rate for this is about 1.4 to 1.7%, and that's compared to a case fatality rate for seasonal flu of 0.1%. So this is definitely more fatal than seasonal flu. Compared to H1N1, it was about 0.4%, SARS 10%, MERS 35% case fatality rate. So the reproductive number, that's what we use to determine infectivity of a virus. It's between 2 and 3, so we're saying about 2.5. So that means that a individual with COVID-19 is going to infect on average 2.5 individuals. And so comparatively, measles had an R0, a reproductive number of 12, and seasonal influenza 1.5. So we're not at the highly infectious stage, and we're not at the really low infectious level either. For an incubation period, it's 0 to 14 days. So that's why when you hear someone's been quarantined for 14 days, it's to accommodate this incubation period to monitor for signs and symptoms developing. And on an average or median, symptoms will develop between 5 to 6 days after exposure. So for public health, so we activated our MACE on February 27th. We've been in monitoring stage since then. So we're just actively keeping up with the situation, giving ourselves updates, updating our partners, things like that. Our main goal right now is to provide clear and consistent communication to both the community and our partners. So we're fielding a lot of calls. We're responding to those. We're developing guidelines based on the CDC and DHHS. And now we're kind of in the phase where we're moving from containment and looking more towards mitigation. So mitigation is going to look like contact investigation of cases, monitoring of persons under investigation, coordinating with our hospitals and healthcare facilities to assess PPE and med surge, And if a vaccine becomes available, then we would do something like open up a pod. So this is the travel advisory. So the travel advisory is constantly changing. As of today, individuals from Europe, most of Europe, will not be allowed into the United States. And so there's current self-quarantine guidelines for people from most of Europe, Italy, Iran, China, and South Korea. So that's where the travel advisory is as of today. But again, this is a rapidly evolving situation, so this is likely to change. So clinical features, so this is person to person, it's spread via respiratory droplet. It is a lower respiratory infection, meaning it's a dry cough, shortness of breath, fever. Less common is sputum production, headache, GI. So treatment and testing. So treatment is just supportive care, so taking care of yourself, getting plenty of rest, fluids, the usual respiratory illness sort of care. Testing, right now the state public health lab, as of this week, just got 250 additional tests. And so they are testing high-risk individuals. LabCorp and Quest Diagnostics also has the capacity to do the testing, and conversations are underway about what we're doing in Nashua for testing.
Right now, if you think you need testing, how are you advising people?
So for right now, what individuals need to do is contact their primary care provider if they develop or are exhibiting symptoms, which were the ones that were just listed on the slide: cough, fever. If folks know that they've been in contact with someone who has been tested and confirmed for COVID-19, they need a provider make them aware of those symptoms. They need to also make sure that they let folks know whether or not they've traveled. And then once that provider will then make a decision on whether or not that individual needs to be tested. Currently, what individuals will have to do is go to the emergency room or to their provider so that they can get a nasal swab done, and then those tests will be sent, those samples will be sent up to the state lab for the confirmation of those tests is still being done through the CDC. So what we're asking people right now is to make sure that the primary care provider, they have to describe what's going on with them, and that primary care provider will make a decision regarding testing. People should not be showing up at the emergency room. They should not be coming to the health department in Nashua or going to Concentra or all these other places without first speaking with their PCP or a provider.
I know there was somebody here from the hospital, I thought, from Southern Hampshire. Do you want to comment or add anything to that at this point?
Sure, I think obviously covered it pretty well, but the challenge we have is that the way the current recommendations are, the way the current recommendations are for testing, the interpretation is that most people will need to go to the emergency department for that testing because most private practices don't have the capability of testing. Unfortunately, emergency departments are pretty much overcrowded as it is, so presenting just for a nasal swab is really hampering our ability to operate effectively. So if you have mild symptoms, we're asking one to stay at home and talk to your primary care providers. We're asking primary care providers to really be up to date with the current recommendations for screening, because we've had a number of people present wanting to be tested or being told that they were told to be tested, but they don't meet the current criteria for testing. That's upset a lot of people as well. So the more we can get the word out and promote off-site testing, we are talking about trying to generate some off-site testing places that'll make it easier for people to get the answers they need. But until then, please either contact your primary care provider or contact the state regarding whether you should be tested or not.
We're working on trying to set up a phone line as well as we've identified an area outside of an emergency room where we could almost do drive-through testing if we needed to for symptomatic but not severely ill, and trying to create a separate area in our emergency room for people to go to, looking at maybe picking, we have 18 different sites, a segregated site. But we're trying to come up with this as a group. If you guys have information about best practices elsewhere, we'd love it. And the other thing that we're looking at is isolation rooms and negative pressure rooms. We do have one entire wing that we were able to make negative pressure, but it still has a lot of challenges. So
Explain why negative pressure is important.
it's important because it decreases the transmission of the virus to other people. So you can have someone in a room with protective equipment outside, but if the airflow is normal, the viral particles will be easily transmitted around. If it's all negative pressure, it should decrease transmission to staff. I'm very worried about staff, both from school closing and quarantines as well as illness. I love that you're working on the act where physicians and providers can go. I'm also worried about respiratory techs and nurses and people answering the telephone, like if I set up a telephone line. So, yeah.
Okay, yeah, so right now we're really pushing the prevent the spread message to the public. So first off, contacting your health care provider before accessing care, staying home when you're sick, avoiding close contact with others, covering your coughs and sneezes, and washing your hands. So here, that's our nurse, Flavia Martin. Those are her hands from the Telegraph. There she is. So this is our message. We're pushing it out as much as we can. We encourage partners to push out this message as well. And we're having conversations with events, group events, if they cannot be canceled, to put this information out there for people. And then just continued general awareness. So good hand hygiene, avoiding the use of masks unless you are experiencing respiratory symptoms, avoiding behaving in a prejudiced manner towards any group of people. So we're just still pushing that out. And then these are our messaging, we're doing weekly calls with the hospitals, with police, fire, OEM, and just staying consistent with our messaging. And we're also in constant contact with the state, who is reviewing the federal guidance. And our website is serving as our hub for information for folks. So if you have someone with questions, all of our updates are on our website. All of our messaging is on our website. So please refer them to that. That's our flyer. And then just some sector-specific guidelines and resources.
And just to be clear, we did let the state public health officials know we were doing this. This morning. They were not able to send someone because, as you can imagine, they're also overworked, but just to try and make sure that the messaging piece, as you point out, which is so important, was clear, and that we're all on the same page in terms of what we're saying to people about what they should be doing. Anything else you wanted to address, Aaron?
Well, I just want to thank everybody for coming. Hopefully everybody will, and I know you will, articulate a consistent message. If you notice things that are going on that public health should know about, I hope you'll contact Bobby Bagley or someone else from the health department. We really appreciate her efforts and emergency management, as well as our public health nurses who are very involved in organizing and leading the city's response.
Well, thank you. As we said in the beginning, you folks are really on the front lines of this, the healthcare professionals, the municipalities, because you're the folks who are in closest contact with the public. And so making sure that you have the resources that you need and the support that you need. I think one of the things that, I don't know if you want to speak to, Bobby, or who, but one of the things that we have been told by the CDC, and as we talk about nursing homes and older Americans, is that, and you've seen this on the news, that the older you are, the more likely you are to have complications. The two groups that are most at risk are the elderly and people with underlying conditions. So if you have some sort of an underlying condition, that makes you more at risk. And so making sure that we have consistent guidance for folks, and I know that that's been one of the challenges. I don't know if you've heard anything from CMS about how you're dealing with the situation.
I'd say that the guidance from CMS has been almost useless in terms of visitation policies for nursing homes. Very ambiguous. It calls upon nursing homes to limit visitation. It calls upon nursing homes to discourage visitation. The limiting applies if you're a county in which COVID-19 has manifested itself, or you're in a county that touches a county where COVID-19 has manifested itself, which means every New Hampshire county now except for Cheshire. This is really an interpretive struggle, I think, for facilities that don't want to appear arbitrary when it comes to family members that understandably want to see their loved ones. I think that in the absence of clear federal guidance, a lot of facilities have adopted very strict visitation policies. I know of a facility here that is doing a virtual visitation and providing tablets to all of its residents. We're hoping for some better state guidance. In fact, I talked to a state epidemiologist last night. I would expect to see either today or certainly no later than Monday better guidance that we can then apply in the facilities and that will be more readily understood. Quickly, while I have the microphone here, we have a huge concern right now about personal protective equipment in nursing homes. It wasn't until Wednesday that US HHS put out an RFP for N95 masks. Responses to that are not due until next week. The masks themselves, I have no clue when those are going to come through. I know facilities are already looking to other facilities to borrow equipment, and those facilities don't have enough equipment to begin with. So, and that's absent COVID-19 having manifested itself in any of our facilities. There will come a point, as there has in Washington too, when it comes to the availability of testing kits, when we're going to want to see some priority placed upon long-term care facility residents and the staff that take care of them. And we have heard very, very mixed messages from the administration with respect to the availability of testing kits. No straight answers whatsoever. And that, I think, is very troubling. With that said, we're the state with the highest rate of substantial compliance with federal health standards for nursing homes. We are going to do our best to try to build firewalls around our facilities and keep this virus distant as long as we can, but it will inevitably get into our homes.
And let me tell you, there has been a change with the CDC on what they're saying about the requirement around N95 respirator masks. So if you haven't gotten that changed guidelines, you should be in contact with them.
Right, they're allowing for the use of the more industrial masks as opposed to the healthcare specific masks, which would be of some help if it weren't for the fact that the general public has now hoarded all of the industrial masks that were ever available through True Value or Home Depot or Lowe's, quite apart from every other cleaning product imaginable, and or all the toilet paper at Costco. So,
yes, well, you point out some of the challenges, and I will tell you that on a bipartisan basis, there has been an effort to both push CMS and the various levers of government to try and be clearer about some of this guidance. So hopefully it will get better, and we will continue to push on that.
And Senator, if I may add, because this is an all-hands-on-deck response, we do need our community members to all work together. So we have our elected officials, our public health, our first responders, all working to try and reduce the spread of this infection in our communities. We need our community members to do the same thing. And so the overarching thing that we need to do is make sure that we don't have a surge of people coming in contact with COVID-19 all at once, because that's going to overwhelm our emergency rooms. It's going to overwhelm our hospitals, our ICUs, with responding to individuals that get very, very ill, as you mentioned, the senior population, over 60, or those who have comorbidities. And that includes children and teenagers as well. Asthma, lupus, any kind of chronic disease is going to put those folks at highest risk. If you're sick, stay at home. Flu season is we're still widespread with flu. We still have opportunities for individuals to help each other by staying at home when they're sick, covering your cough, washing your hands, not touching your face, and wiping down surfaces. Those may sound like very simple measures, but those are very key things to do to prevent the spread of COVID-19. And so we're asking our community to work with us as we work to spread this out over a longer period of time, because it's not if now, we're in the when situation, when this happens, but we all need to be working together to protect our most vulnerable populations and ourselves by doing those very simple things. They actually do work. Hand washing does work.
Can I also add the social distancing? It's very much our habit to shake hands with each other and hug each other. So if we could just change that to the L bump, or, you know, your hand over your heart, or something like that.
Yes, very good point. Thank you.
Could I? I just want to second Brendan's comments. On Tuesday afternoon, some of the Senate committees had briefings from the state epidemiologist, the insurance commissioner, and the education commissioner. And I asked the state epidemiologist whether the state was suggesting any changes in how nursing homes and other long-term care facilities were approaching, I don't know, isolation or cleanliness or something.
Visitors.
And he said they hadn't done it yet. And to me, that said, we haven't gotten the guidance from the federal government that we need.
I think that's absolutely right, and Brandon will tell you that we called him 2 weeks ago now, because I was at a briefing and they suggested that there were going to be guidelines coming out for nursing homes, and they were not really effective.
It's really been frustrating.
Mm-hmm. It has been. Yes. Any other comments that anyone would like to make? Yes.
I appreciate that. So we have several of those in the audience. We have my friend
It's
Mike.
allergies, by the way, just to be clear.
That's okay. I felt like I was at least a meter away from you. So we have several nonprofits here in the audience today. We have Michael from the Soup Kitchen. We have our friends from our 2 FQHCs. We have several others in the audience. One of the things I know that you're going to be working at is expedited ways to get some of the federally approved funding down into the state and ultimately to the municipality. We haven't talked at all about how that gets down into the social services sector. And this is really important because, like in most communities across the country in Nashua, our social services nonprofits provide some of the most critical services for food, clothing, shelter, basic needs. And unlike the school district, which could probably say very, well, not easily, but could say, we're just closed. Everybody go home. Well, that affects all the rest of us that provide those services. Kids are going to have to eat over the weekend. We have a need for that, and we can't just stop feeding them. So what I would ask is that in some of your conversations with your colleagues that you give some consideration to how we expedite funding to the social services sector, especially because you mentioned the Plus Company's Wild Irish Breakfast. Well, that's their biggest fundraiser of the year.
Right.
At the same time as we have increased need for expending money to meet these needs, we also have decreased fundraising ability, and there are a bunch of those coming up in our community in the next couple of months. Mm-hmm. So please keep that in mind. We've created an emergency response fund at United Way. But there are also direct needs. Anything that can be done to help facilitate that would be appreciated.
Thank you. I really appreciate you raising that. Maureen Beauregard also raised this with us, and I think much of the discussion that I have been part of and have heard about has been focused on individuals, on people who may not be able to work and therefore not be able to collect their paycheck, and how we can help them. But I haven't participated in any discussion around how do we protect social service agencies who may have funding needs. So I really am glad you raised that, because we are going to go back now and talk about that as one of the things that we've got to single out, because that's a particular challenge.
Sarah has my contact information.
Yeah, no. Yeah. And I don't know, Pam or Nick, would either of you like to raise anything from Senator Hassan or Congresswoman Custer in terms of efforts that?
Thank you for this discussion tonight, Shaheen. I think we covered a lot of the similar efforts we're working on. Senator Hassan served on HELP and the Health Committee and the Homeland Security Committee. So through there, pushing for the president to issue a disaster declaration, which there is some word that may happen, which will help make additional resources available to states and cities as well.
Yes, thank you. And I think it should be clear that we're all trying to work together on this. We're trying to work closely with Governor Sununu as well to make sure that we're all in this together. Nick?
And I'll just add, I know you alluded to it earlier, but the House is currently in negotiations, and there's hope that the agreement will include support for programs like WIC, emergency food assistance programs, and SNAP relief, things of that nature. So that's all ongoing.
Thank you. There were two other hands here. Yes.
Hi, my name is Michael Ronkin. I'm with the Nashua Soup Kitchen and Shelter. Just 3 quick points, one of which is that our second largest fundraiser for the year is currently scheduled for 3 weeks from now, and my guess is it's not going to happen, and that's going to impact our budget. But one of those 2 things, one of which is we talk about people staying home if they're sick. We provide services to people who don't have a home. And so there's something in the order of at least 55,000 people across the country who are sleeping on the streets tonight. I think that needs to be considered in terms of how that's a population that if we want to contain an epidemic, they need to be assisted in some way. And then the people who we are sheltering, a shelter is basically a large room with a whole lot of bunk beds. And so there are things you can do to try to limit, but that is, again, additional cost, whether it's curtains or anything else. So there is this way to fund shelters across the country through the Emergency Services Grant. And as we're looking for increasing funding, considering funding, additional funding for the Emergency Services Grant for shelters across the country would be very, very welcome. And the last thing is we talked about closing schools. And there are 4,000 kids in Nashua who get free or reduced lunch just in this city alone. I believe it's over several million across the country. There is a program that helps provide food for kids called the Summer Supplemental Feeding Program. But there's a big problem with that, which is that legislation requires that kids actually eat there, which I for years have said is crazy, but especially so now. So if we can eliminate it, put funding towards that so that when schools are closed today, that program can kick in to provide meals. But then even if we're saying that they need to do shelf-stable meals, allow the kids to take the food and bring it home, because we don't want to, if we're closing schools, we don't want to have the kids, okay, now we're all going to get you back together to eat together. It's not, there's no point.
Yeah. Mm-hmm. I hear you. Thank you. Yes. Can you identify yourself?
We are healthcare for the homeless, and if we have homeless that we need to provide and send, you need to be in quarantine. This is a problem because we don't know where tell them to quarantine. So this is something that has to be in the government.
I know that the woman from St. Joseph's talked about what they were doing around quarantining. Is this anything, Bobby, that you all are looking at the city in terms of what space might be available if somebody is homeless and tests positive who needs quarantining?
We have not identified a space where we could actually take folks in so that they can be quarantined in one space. We have had an incident with an outbreak of tuberculosis with a homeless population that was very difficult to track down. If we can put that in place, that would be helpful to keep the spread from going through the community. So as of right now, and I don't know if Mike or Michael could speak to if there's a place. It's okay. We're trying to identify a place of containment for folks if we have to quarantine folks that are identified as homeless.
So that's a need that we've got both at the community and at the state level, I'm sure.
We did talk this morning with hospitals about should there be a central location for quarantined people in general, and their answer was it's better to stay. And of course, we're addressing people who do have a home, not the homeless here, but their response was it's better to stay home and just try to do as well as you can there.
Mm-hmm. Do you want to?
I think Tim.
Bloomberg News is reporting that Trump just declared a national emergency.
Oh, good. Under the Stafford Act, right? Because there are several different. So that would give us the additional emergency authorities. That would be helpful, at least with medical personnel. Yes,
Now,
I think.
One more introduction, Brandon Laws is from the Board of Aldermen.
Ah, good.
He's an alderman at large. So my question, we've covered this a little bit, but my question is around food insecurity. I know that Mike Rinka covered a bit of that, but if we entertain or need to close schools, 44% of our students are on free and reduced lunch, and many of their meals come at school. So is there federal funding, or is the city looking at opportunities to make sure that if we get to that point, that those students aren't going hungry?
I can tell you that's part of the discussion at the federal level. I can't tell you how that's been resolved because I don't know what's in the package yet that's coming out of the House, and the Senate obviously may or may not make some changes to that. But I think people are very aware that that's a huge challenge and we've got to address it. I think we've got time for two more questions, Peter says. So.
I'm Maureen Gorgat. I'm with Easter Seals, New Hampshire. And I appreciate being able to be here. I'm curious about, we employ 1,600 people. We touch 25,000 lives. And it is the most fragile, et cetera. We have 24 independent homes. As we look at moving through this, we're going to have to turn down services because everything we do is billable. Aside from the fundraising that we do that we can't do, that others explained, we're going to have to downsize and figure out a way to work with the most fragile. When this is over, and it will be over, I'm optimistic. I'm very, very worried about how we start this sector up again. Easter Seals is a large organization. We don't have it. The Easter Seals across the country don't have it. We're talking to people in Washington. We have these affiliates in Washington. They're saying we are already so badly affected. So they're our bellwether. It's coming. So while we have to look at today and making sure that we take care of the most fragile, we need to think about how we turn this sector back on. Thank you.
I totally agree, and that's got to be part of our discussions. We had a hearing in the Small Business Committee yesterday where what we heard was that small businesses who have to close down because someone may test positive, just giving them a loan doesn't help. If you have to close your business, a loan that you have to pay back, you're not going to be able to cover. So that may be a place where we could cover some of the social service agencies. I think we've got to take a look, and I certainly intend to bring that issue back. And I know Senator Hassan and Congresswoman Custer will also be interested in trying to address that. Two more. Yes, we'll do you, and then final question.
Senator, thank you for being here today. We're reacting very well, as we do to most emergencies here in the country, and it is a bit reactionary. And the chief medical person for the president has testified before Congress, and said that we weren't well prepared for this. So as we're going through this, is there somebody that's keeping track of lessons learned? And so this happens again, we have a better playbook to handle it?
I can tell you that came up yesterday, and Senator Murray, who of course represents Washington State and has been at the real heart of all of this challenge, said that she had a commitment that I think we all support, that as soon as we get through the worst of this, that we need to appoint a commission or have an investigation in Congress to take a look at what went wrong, what should have been done better, so that we're not in this situation again. Because, you know, what, today is March 16th, March 15th? 13th, sorry. It only feels like March 16th.
Friday the 13th.
Friday the 13th. But here we are, you know, the first case appeared in January. We're 2 months later, and we still are waiting for widespread testing. So we cannot let this happen again, and that's why a clear investigation of what we need to do better next time is warranted. So thank you for raising that. Final comment.
Pastor Kim Hester of Christ the King Lutheran Church here in Nashua. And I just want to say I've been meeting with a lot of interfaith colleagues over the last several weeks trying to coordinate and collaborate, and we're here. And we want to be connected in the chains of conversation and to help as we can at the same time while we're educating and working with the people in our individual communities. So please keep us in whatever loops we can be in.
Well, thank you all so much for the productive discussion. Thank you to the Public Health Department in Nashua, to the mayor, to the state senators. Bobby, we really appreciate you and your staff, and to police and fire and everybody who's responding to this crisis. Obviously, there's a lot we still don't know and a lot we need to do. And I think if we work together, we have a better chance of getting ahead of it and responding in a way that is important to all of those people who are affected. So thank you all very much.
Thank you.
Thank you. Oh, yeah. I'm not going to let you steal my minute.